and welcome to EMC News on Lone Star Community Radio. And we are now on FM 104.5 and 106.1 from downtown Conroe. And no, it's not raining now, but there's a pretty big windstorm coming this way, so don't leave anything outside. You could lose something. Very quickly, the wind is really blowing. So we record live every Monday at noon, and I'm your host, Margie Taylor with EMC News, and we hope to give you some information about things that are happening in Porter, New Caney, Splendora, things that are happening with the Greater East Montgomery County Chamber, New Caney and Splendora school districts, law enforcement, nonprofits that serve East Montgomery County, and local businesses. So listen in every Monday at noon to learn about Lone Star Community Radio. Today, we welcome Randy Johnson, CEO of the Montgomery County Hospital District. But before we talk to Randy, let's go over a few updates that are happening around our area. And of course, we're back from Thanksgiving. I hope everybody had a great Thanksgiving week or days or whatever it was. And now the Christmas season is upon us, and there's so much going on. Friday, this coming Friday, is the African Children's Choir, and that will be performed at Peach Creek Elementary at 6:30 p.m. I believe that's free admission, and they are located on FM 2090 in Splendora ISD. Speed Street, yes, I said Speed Street, is now open today. They are having a ribbon cutting right this minute in conjunction with the Speed Sports Racing Complex. This road is going to connect 242 and Highway 59 to the attractions to be open soon with Grand Texas Theme Park. And no, it's not open yet, but they have the RV park is underway. The water park will be the first thing. And the Speed Sports Complex, hopefully we'll have him back on the show again really soon. He is getting ready to open that with his race cars that go about 85 miles per hour. It's a good thing he has the Speed Street open right now. The Splendora High School Cosmetology Department is sponsoring a Tiara and Princesses with manicures, pedicures, hairstyling, updos, and makeup. This coming Saturday for $25, and it includes a free photo image. Young girls 3 to 13 are welcome to call and schedule an appointment. You can call 281-689-4305 or go to the Splendora ISD website to see the flyer. New Caney ISD will host their Hour of Code, and this is the third annual Hour of Code, 6 p.m. next Monday at the community room at Texan Drive Stadium. This is a really unique event. This is an event based on technology, and it's hosted by guest speaker Jamie Johnson. He's a data scientist for an oil and gas company. Have you ever heard of a data scientist? It sounds very involved to me. But you're going to go through age-appropriate coding activities, and it's open to all kids, kindergarten through 12th grade. Please bring your Chromebooks. It's a free event, but all participants must register on the New Caney ISD website to attend. Technology is now, and we want our students to be prepared. So again, that's Monday, December 5th, and register on the New Caney ISD website to attend the Hour of Code. College Connections will be September 3rd. Like I said, there's a lot going on. So Saturday, December 3rd, 9 to 12 at the Early College High School on Eagle Drive for New Caney ISD. Parents and students are invited to talk to representatives about how to receive financial assistance for college. If you need more information, visit the New Caney ISD Facebook page. And that's open to all ages of students. It's never too early to start planning for college. Heaven's Army of Resources having their 6th annual Operation Giving Heart Christmas outreach on Monday, December 19th from 4 to 8 p.m. They are needing toys, bikes, and volunteers. And if you're in need of assistance, or if you know someone who's in need of assistance with Christmas toys, the cutoff for that is December 9th to connect with Lenora Purvis with Heaven's Army of Resources. Her number is 281-689-5864. If you have never seen this outreach, it's tremendous. You can set up booths if you're a vendor for free as long as you do a children's activity. And other people are always welcome. KSBJ will also be there. Toy boxes are set up for donations at Snap Fitness. East Montgomery County Fire Station, Fishtails, Academy, Heaven's Army, Rhonda's Family Hair Care, the Roman Forest Police Department, Remax Porter, and Caney Creek Cowboy Church. Get involved in this fabulous event that serves over 1,000 kids in East Montgomery County. Some upcoming calendar dates. Concerned Citizens is meeting December 5th, that's next Monday, at 7:30 at the library with all your East Montgomery County officials providing updates. The Greater East Montgomery County Chamber monthly luncheon is Wednesday, December 7th from 11:30 to 1. You can register online for that luncheon. The guest speaker will be our own Rick Hatcher, president of the Greater East Montgomery County Chamber. Please bring non-perishable canned food donations for Mission Northeast. Suggested items include canned chili and hearty soups, and even a handheld can opener, because a lot of people don't think about that a lot of times they may not have access to electricity, unfortunately. Save the date. Sunday, December 11th, Tavola Community is presenting their reindeer run. And I'm pretty sure there won't be reindeers, but there will be runners. And 5K and kids 1K run. It is a CHIP sanctions race with fun for everyone. What does CHIP sanction mean? It means that they time your event and you get awards. And you can sometimes even track it online where your runner is. But it's a 5K, so it shouldn't be longer than 30 minutes or so. Anyway, the Greater East Montgomery County Chamber Gala is, you can plan ahead for this, is Friday, February 17th at the Kingwood Country Club with a Las Vegas theme. They're still looking for sponsors, and the sponsorships go from $700, which is a Monte Carlo sponsor with a table, to $5,000 level as the Bellagio sponsor. Admission is $70. If you want more information, go to the Greater East Montgomery County Chamber website. So, again, I am Margie Taylor with East Montgomery County News, and it's an hour-long talk show, Mondays from noon to 1, and we will be right back in just a few minutes with Randy Johnson, CEO of the Montgomery County Hospital District.
EMC News, your local news from EMC every Monday at noon on Lone Star Community Radio.
When medical emergencies happen, trust your best neighbors ever for extraordinary emergency care from board-certified physicians. Neighbors Emergency Center is making lives better by providing exceptional medical care for you and your family, 24/7, 365 days a year, with little to no wait time. With Montgomery County locations in Porter and Kingwood, Neighbors Emergency Center is there for you. For more information on Neighbors Emergency Centers, please visit them online at nec24.com.
Want to know what's happening in East County? You're listening to EMC News on Lone Star Community Radio.
Hello, we are back on EMC News, recording live from downtown Conroe. I am Margie Taylor, your host for the show, as I'm here every Monday at noon. And a podcast of this show will be available on SoundCloud and YouTube by tomorrow morning. You can go to our show page, irlonestar.com/EMCN, or check us out on Facebook at EMC News for the latest podcasts. You want to be a sponsor or a guest? This is a great way to get information out about your organization or business. So today we have Randy Johnson, CEO of the Montgomery County Hospital District. Hey, Randy.
Hello. Thank you so much for having me.
Oh, you have a great voice on the radio.
Well, thanks.
So, Hospital District. What is the Montgomery County Hospital District? I mean, I know what it is, but tell everybody else. I mean, it's not a hospital.
It's a very confusing. The hospital district was started in 1977. It's a government entity. It's a county government entity. It was started in 1977, and the purpose of the hospital district was to pay for indigent care for those residents of the county who could not afford to go to the hospital. Originally, in 1977, Conroe Regional Hospital was the county hospital. Mm-hmm. And the hospital district was set up as a mechanism that could tax the residents of the county some additional taxes to pay for the shortfall to take care of the indigent residents in the county. Now, in the early 90s, Conroe Regional Hospital was sold. It was sold to Hospital Corporation of America. So the hospital district continued to collect taxes, and we continue to pay for indigent care for those residents in the county who have no other means of health care. And I think this is a very smart way to go about paying for care, because hospital districts don't do a very good job of operating hospitals. They have to be all things to all people. Now, we contract with all 5 major hospitals in the county, and we are able to make sure that the patients get very good care from very busy hospitals who see lots of patients, and we're able to contract at a very reasonable price at each hospital, so it's a very good deal for the taxpayer.
So is this for anybody who is not covered by Medicaid, any other insurance plan? Is that correct?
We are, by law, the payer of last resort.
Okay.
So if you're able to be covered by Medicare, Medicaid, Obamacare, any kind of insurance, then we cannot cover you. If you're a resident of the county, we can cover you if you're below the federal income poverty level. If you're an illegal alien or an alien, we cannot cover you. That's mandated by our
So someone that owns a small business like myself,
yes,
and does not have other medical coverage, isn't old enough for Medicare, and can't qualify for Medicaid, would I qualify for that?
Well,
or how does that work? We
have to do a means test for you. And so by mandate, your income has to be below 133% of the federal income poverty level. And you'll say, what does that mean?
So no, the answer to that question is no.
Okay. So basically
right.
for a family of 4, you'd need to make less than $30,000 per year.
Okay. All right. So that's really the guideline. And then what is the process if somebody needed it? And does it cover regular medical bills, or is it just for hospital care? How does that work?
No, we have contracts with all the hospitals. We also have over 500 physicians who are on our contract panel, and we will cover inpatient, outpatient,
the whole thing,
hospital care,
whatever's
whole thing.
needed.
Exactly.
So what is the process? Somebody goes online and fills out an application, or do they go to your offices in Conroe?
The answer is yes.
Okay.
You can go online, you can call, or you can come to
whatever.
our offices, and we have individuals who will help you, and they work very hard to make sure that you get the information that proves that you're a needy resident of the county, and then we'll be willing to pay for your care. Now, this is... we pay for care that you actually need at this time. You can't go online and sign up in the event that you may get sick later. You need to wait until you actually have the need for health care to come to us, and then we'll take care of it.
So it's for individuals that find themselves in an accident or a debilitating circumstances, physical, where they can't work and they need hospital care or they need to see a doctor, and they don't have, like you said, any other resource available to them to get the medical care they need.
That is correct. And as a matter of fact, you could be admitted to the hospital. You could be, say, you're admitted to Kingwood Hospital. If you don't have many resources and you have no kind of insurance, then you can call us after admission, and many times we pay for patients who've already been admitted to the hospital.
Okay, that's good to know. So you serve the indigent, but you also provide EMS services, correct?
That's correct.
How does that work?
Well, we provide the emergency medical services for the entire county, not only East County, but all of Montgomery County.
The entire county, correct? And so you have substations throughout the county, whether it's Magnolia, Willis, Conroe, the Woodlands, New Caney, Splendora, wherever. You have substations where you have the ambulances located.
Well, that's correct. We work to make sure that we're most available in 2 ways. We have 24 stations where we're located throughout the county, but we also move our ambulances. We have a computer program that tracks the last 5 years of data of when we've had calls, what time of day, and where the calls were. So we actually move our ambulance units to the location where historically they've been most available to take calls. So that way we can be a dynamic ambulance and not just wait for the calls from the stations.
Well, also, that brings up another point. I remember when I was in leadership in Montgomery County, we toured the hospital district. Seems like we did.
Yes.
And you also can look on the computers and see where an ambulance is at any given time, and then move somebody else to an area that needs to be taken care of. Is that correct?
That's correct. Many times we'll have several people having calls at the same time. And we normally run 24 ambulances, but if everybody's busy on calls, busy at the hospital, and we're down to 8 ambulances, then we put people in the ambulances and we actually have them sit at street corners where we think there's the most possibility that they're going to have the next emergency.
So that you're always there in the area of the county where you could be needed at any given time with the quickest response time.
That's correct. And typically, we have about 150 calls per day.
Wow.
And East County usually averages between 30 and 50 calls per day. So East County is a very busy place.
So it sounds that way. I mean, if you're saying that they get anywhere to up to a third of your daily calls.
Yeah, anywhere from 20% to 33% of our calls.
Wow, that's a lot. So where are you located in East Montgomery County?
Well, we have 3 stations, permanent stations in East Montgomery County. One is in the fire. We're located in the fire station in Porter. Then we have a independent station on 494 in New Caney, and then we have another station right off 494 in Splendora. In addition to that, we also have a couple of ambulances that operate freely depending on where we think the next call will be. So they're
Right.
located where there's the biggest need in the area.
So you're always watching. You have someone who's always watching to see what's going on, tracking it, and helping to communicate to other paramedics to go where needed, when needed.
Yes, and we have a very good program in East County, actually throughout the county. But we work very closely with our first responders, with the firemen there, and typically when we get a call, the firemen get the call too, and so they can be there to speed up the time of arrival. They'll take care of the patients until we're able to take care of the patients when we get there. So
And usually the fire departments are one of the first on the scene, aren't they?
They usually are.
And they
yes.
always go to all the medical calls.
They do, and they do an excellent job. Very caring, very good.
Okay, so who pays for this?
Well, that's a good question. This is paid for in one of 2 ways. The first person, all the taxpayers in the county pay county tax. We charge 6.6 cents per hundred on your property evaluation, and we've been actively trying to reduce our tax rate for the last 14 years. And as a matter of fact, we've reduced it in half. It used to be almost 14 cents per hundred. Now it's less than 7 cents per hundred.
That's good. You're very efficient.
So we're very proud of that. Mm-hmm. So that's one way that we have the services paid for. The second way is we do bill for our ambulance runs, and I'm very proud to say that this year we have dropped the cost of our billing by about 45%. And I'll give you an example. The most critical type of ambulance call that we go on usually is a heart attack, because that requires the most equipment, the most training, the most drugs. So let's say that I have chest pains, I fall over. The medics come, they hook me up to the machines, they give me the drugs, they haul me to the hospital. Last year, that would have cost about $1,500. And typically, Medicare pays about $500 of that. So after Medicare pays for $500 of that, you may still be left with a $1,000 bill. And we'll work with you on billing, but that didn't seem like that was really fair. Now, that's a fair charge because that's what the ambulance services in the surrounding counties charge, that or more. So we felt that that was a good charge. But this year, we're fortunately in a position where we could reduce our charges. So now, if you have a heart attack, the most severe, the most costly kind of care, we'll charge about $750. So now if Medicare pays $500, the out-of-pocket cost for you, and we'll work with you on that, is $250. So I think that's much fairer.
Reduced. Oh, yes, absolutely.
And I think that's going to be a very good service for the community.
That's good to know this stuff. So you provide the EMS services throughout the county. So, and you go on all calls. So you get so when somebody calls 911 and then it's dispatched, they ask you if whether it's fire or you need medical attention or you need police, right? And then from there, does it come to you?
Yes, I'll take just a moment and explain that. If you call 911 anywhere in the county, if we get a call anywhere in the county except in the city limits of Conroe, the sheriff department is the first person who picks up the phone and answers the phone. So you'll get that call, and then they'll say, do you need fire and ambulance or do you need police? And if you need ambulance, then the call is transferred to the Montgomery County 911 Center. We answer the call there, and we'll direct the ambulance and the first responders to your location. But we're also accredited so that depending on the call that you have, we can actually start helping you give medical care to your loved one while the first responders are
very nice while they're
yes.
on the phone.
Yes, we can tell you how to do CPR, how to deliver a baby, how to help stop bleeding.
Right.
So it's excellent care on the phone.
That's great. It's great to know. So how many people call for 911 just to go to the hospital emergency room, or just how many people call the fire department or call you guys just to go to routine doctor visits?
Well, in a year, we get about 50,000 calls. And of those 50,000 calls, everybody considers their call an emergency, or they wouldn't be calling 911. It's an emergency to them. But we do have probably about 15% of the calls that we get are people that call us on a routine basis, really because they feel that I think they don't have anywhere else to go for health care. So they may call us, and they'll call the firemen as well several times a week to help take care of them in their home, or to take them to the hospital, or to take them to the doctor.
I know that the fire department often gets calls for people because they have problems getting transported
Yes.
to regular visits, things like that. So is that something that you normally take care of then? You're saying that's the 15% that occasionally will call
Yes.
and need services.
We get a variety of those kinds of calls. We get a lot of calls especially from elderly people. They may fall and they just need help getting up, and so we'll go with the fire department and we'll pick them up, put them back into bed, and then we'll check them to make sure that they're okay. So anywhere from that to taking patients to the hospital. We're really not allowed to take a patient to a doctor visit. Since we're a 911 service, we really need to take them to the emergency
go to the hospital.
room. Yes.
Right. Okay, well, this is good information all about what exactly you do and how you help people throughout the county. But you also have other programs, and we can touch on that in a minute, then we're going to take a little break. But you work with preventive programs, and you do research, and you also have 6 emergency radio towers. Where are those? Are those throughout the county so that you can communicate better and more effectively?
They are. They're located throughout the county, and we share those towers and our radio system with the city of Conroe. And we think that with the growth of the county and East County, particularly in the southeast part of the county, we'll probably be adding a couple more towers over the next 2 to 3 years to better manage our coverage. One tower,
as we grow, yes.
Yeah, one tower we think will go in the very southeast part of the county, and the other tower will go just west of Conroe.
Great. Okay, well, we will be right back in just a few minutes with Randy Johnson of Montgomery County Hospital District. I am Margie Taylor, your host for EMC News.
Stay tuned to the EMC News Hour with your host, Margie Taylor.
Animals of all shapes and sizes are welcomed at Big Thicket Vet in New Caney, with vet services like extensive health exams, vaccinations, heartworm, tick, flea prevention, along with experienced and trustworthy emergency and urgent care. For more information on Big Thicket Vet in New Caney, visit bigthicketvetnc.com or locally at 18403 FM 1485 in New Caney, Texas.
Stay tuned to the EMC News Hour with your host, Margie Taylor.
Hello, I'm Margie Taylor, and this half of EMC News is sponsored by Neighbors Emergency Clinic. So when emergencies happen, and of course we're talking about emergencies here with the hospital district, but they will help you 24/7, 354 days of the year with emergency care. So we are back here with Randy Johnson of the Montgomery County Hospital District. And before we took a break, we were talking about people that need continual care, possibly. Can you tell me about this program that you have that you mentioned that is part of a community paramedics program?
Yes, about 3 years ago, we were having difficulty. We had lots of patients that were chronically ill or older, and they really didn't have transportation. They had very little resources, and so they would call 911 frequently when they needed to be picked up and placed back in bed, when they needed medications or physician visits or to go to the doctor to be checked on.
Yes.
So we set up a program where we have 5 paramedics who are called community paramedics, and they have taken 150 of these types of individuals, and they work with them to make sure that they understand the medications that they're taking, their hospital discharge instructions, that they have a medical home, a physician's clinic, and they watch them, look in on them, and make sure that they're managing their health care appropriately. And it's been a very
Sounds
successful
like a great program.
And it's reduced the number of 911 calls from people who really aren't 911.
But they need help, they're chronically ill,
yes,
or they're elderly, or something else going on. How does someone get involved in that if they wanted to be part of that program?
Well, you could call the hospital district, but typically the way we work is we look at the people who are calling the most 911 calls, and we actually offer our services to those people because we think
so it's kind of an outreach program to help people.
Absolutely, yes.
Very good. So you also have something that where you analyze trauma, stroke, cardiac arrest. Tell me about that with researchers and things like that.
Okay,
what that program is.
One of the things that I'm so proud of is I think that the EMS service in Montgomery County is probably one of the top 5 or 6 services in the country. And one of the things that we do is every time we go on a call where we have a cardiac or a heart attack problem, we have a stroke, or we have a wreck or trauma, we have a series of medics who review that call to make sure that we did the very best care that we could do. And if there's anything that's confusing or perhaps something that could have been done better, then those calls are given to our medical director, and then he reviews them. And then if there's any ways that we can improve what we did during that call, the medical director will work with the paramedics who were on the call to improve care next time. Now, as a result of that, and because we see about 50,000 calls per year, we're actively involved in making sure that we're doing better and better and better care. So we're involved in research, and we do a lot of publications for the EMS journals throughout the country. And I think that's a way that we're able to give back, but it's also a way for us to improve our care. A good example.
Right, so it's a very positive thing.
Yeah, a good example of that is we found that for trauma, it helps a lot if we do a thing called a finger thoracotomy, and that's actually where if someone's really, really in bad shape, we can make an incision in their side, and we can let the excess blood and water out so that they can breathe easier. We've been doing that, and we've actually been able to save lives that weren't able to be saved before we started doing that type of care.
So are you saying that you guys are innovative with that and with that approach?
We are, but we're also careful. We like to use the term, we want to be leading edge, not bleeding edge. We want to make sure that what we're doing...
Makes sense.
Yeah, we want to make sure that what we're doing
stop the bleeding
is being done somewhere else, so that we're doing best practices,
right.
And it's very important that we do it that way.
So, and then when you do this research that's ongoing, sounds like you're doing that with every call of.
Well, with every call, that's really a quality benchmarking and a quality improvement, because we want to make sure that every year we benchmark what we've done the last year, and we want to see how can we improve our call response time, the care that we give when we get there.
So it's a quality of measurement of what you can go back and see where you've been and be more efficient and do a better job. Okay.
We also meet with the 5 hospitals quarterly, sometimes more often than that, with the hospital administrations and with the emergency department personnel in the hospitals, and we talk about any transfer issues that we're having to make sure that that the pre-hospital care is the best that it can be, so that when patients are admitted to the hospital, they don't have any complications. that they shouldn't have in the hospital, and
That's
they get
great.
through the hospital faster.
Communication is really important.
That
for
that works
everything.
well. Yes.
It's a good partnership. So I'm learning a lot, actually, about all the different things that you offer out. But another thing that you do that we haven't really touched on is that you have ongoing classes. You have some put on by the American Heart Association, and you have some safe sitter programs, car seat checks.
We do. We try to do a lot of work to aid the community, and so we do safe sitter checks. We do CPR.
Kind of like a babysitting certification type of thing?
That is correct. We also check car seats because most people don't have their car seats put in the car properly. We want to make sure that the kiddos are as safe as possible. We do CPR on a continuous basis, both at our main location in Conroe and around the community. We also do first aid training, emergency care attendant training, emergency medical technician training. We also do training, PALS training, which is medical care for infants, for paramedics, not only in our service, but in services all around the area. So we have training classes ongoing.
Ongoing all the time.
Yes.
Is there a fee for any of these classes? I'm assuming there probably is.
For some of the classes, there's a nominal fee, but we basically just charge the cost of the books and materials and instructor time. So we try to keep it as low as possible.
So these classes are good anytime you have a employer that's asking you to take CPR, first aid, or you're a new parent and you need to or going to be a new parent, you're pregnant and you're getting ready to have a baby, so you need to have the car seats checked. And for when you go out and you need a reliable, certified babysitter to come watch your children. So they learn basic things in the babysitting. Do they also have CPR or basic things on that? What's in that?
Yes, they do. They do teach basic CPR on that as well. Yes.
Okay, so and to call the phone and get on the phone and tell somebody, and they'll walk you through it.
That's right. And if you call 911, then we will help you with your CPR
Right.
on the phone.
Oh, okay, yes. So another thing that you guys do is work with getting out information to protect the residents of Montgomery County, whether it's the Zika virus or epidemics or flu shots, or Zika is the mosquito one, right? Okay.
That's correct, yes.
Or any other thing going on. I know in years gone by, we had an epidemic where everybody got shots. What was that for? I can't even remember.
That was a flu epidemic several years ago.
It was the flu.
Yes.
Yes, it was a strain of the flu, and there were places that were giving free shots at schools or whatever. So are you guys still involved in that kind of thing?
Well, we are indirectly. The hospital district board, we also have a public health district in the county, and the hospital district is responsible for managing the public health district. And the public health district is responsible for all the infectious diseases that come through the county, to see where they came from, where they're going, and can we manage them, can we control them. The public health district also takes care of all tuberculosis cases in the county.
Right.
And the public health district also does immunizations for children in the county.
But you partner with them. But they're a separate entity, is what you're saying?
They are a completely separate entity, but we manage them.
Okay.
Yes, for the county.
All right. So if, let's say, there's an outbreak of
Zika.
tuberculosis, something. I mean, there was also something with TB not too long ago, seems like.
Well, let's say there's a tuberculosis case. If there's a tuberculosis case or several, and it's active tuberculosis, then the medical director of the public health department, he's the health authority, he actually has the power of the state, because the public health department is a part of the state health department. He has the power of the state that he can go in and he can quarantine the area and make it safe until...
have we ever had that happen?
We have come close in the 5 years I have been here, but we've not had it happen yet. We've been very fortunate.
What was the reason?
Well, we had a case. This was actually in South County. We had a case where we thought the hantavirus had occurred, and this is a very dangerous, deadly virus that's caused by vermin. And when the tests came back from the state, it turned out that it was not the hantavirus, and so we did not have to quarantine.
So that was low profile.
It was low profile, yeah.
But you knew about it.
But we knew about it. Yes.
Right. Ready for action. Yes, I remember the flu was the big one, and then there was the one with the TB, and then all the emergency responders were getting, and their families were getting taken care of first.
That's correct. And we also had an Ebola scare a couple of years ago.
Oh, goodness. So when any of these happen, who does that go to? I mean, is there a reporting system in place for the CDC, and how does that work? So if you're at a school and you see somebody with tuberculosis, do they contact you, or how does that work?
Yeah, that is a reportable disease, and the schools will contact us, and we will coordinate with the state section of the health department, and we'll coordinate reviewing that illness,
and go on
getting
from
information,
there,
and going from there.
Out.
Yes.
Okay, we're going to take another little break, and we're going to come back with Randy Johnson and talk about emergency preparedness and a few other things and how you can connect with the Montgomery County Hospital District. I am Margie Taylor, your host for EMC News.
Lone Star Community Radio is Montgomery County's community radio station, and we're looking for more talk shows and volunteer DJs for our music shows. If you're interested in having your own talk show on Lone Star, or always wanted to live out your dream of being a music DJ, contact Lone Star Community Radio online at irlonestar.com/contact us, or call the station at 936-647-5747 for more information.
Check out EMC News on Facebook. Like us to see more about coming shows and guests.
Hello, we are back on EMC News from downtown Conroe with Lone Star Community Radio. And, of course, we are now on FM 104.5 and 106.1, soon to be also televised on the local cable very soon. So, not raining now. Looks kind of like still a little windy, but this is kind of fun. And if you really want to see what's going on in the radio here, there's also a window at Conroe Coffee. You can sit and watch us and make faces at us, I guess. So, go like us on Facebook and see about what's going on in East Montgomery County. There's always something that's posted, whether it's from the law enforcement or the school districts or the chamber, nonprofits, anything else. So, again, we're back here with Randy Johnson, who is the CEO of the Montgomery County Hospital District. And we're going to talk a little bit about where you might see the ambulance, the hospital district trucks, vehicles, that is not in an emergency. Hopefully not emergency, but they stage for events all the time. Right, Randy?
Yes, we do. And it depends on time of year, but usually every weekend, Friday and Saturday, we have anywhere from 3 to 8 trucks that will stage, which means standby for specific events. And this is a very busy county. We have lots of events going on, and so as much as possible, we try to have a dedicated truck at these events. Sometimes we don't have the resources to have a dedicated truck at every event, but we'll have a truck in the area so that we're very close. But we have a truck for all the football games, all those events. We have a truck also for we have several trucks for Ironman when that happens. That's an all-day event.
That's a major deal, right?
And
probably the Woodlands Marathon too.
We do have one for the Woodlands Marathon. We have one for the Catfish Festival, the Sawmill Festival.
All the major events. Were you out at the Sawmill Festival?
Unfortunately, I was not.
Not you per se, but the hospital district?
The hospital district was at the... And we also have a couple of special programs for those type of events. In addition to having our trucks available, we also have a bike team. So if there's a run through the woods or anything that's tough, we have bicycle medics who can follow you in places that the ambulances can't go. And so it makes it a lot more people friendly. And then finally, we also have SWAT medics that work with the sheriff's department and with the police on special calls to make sure that they're safe. And if something were unfortunate to happen, they'd be there immediately available to help them as well.
So if somebody had an event and they wanted to have the hospital district there, I noticed today that you have a place on your website where they can inquire about getting involved.
Absolutely.
And that way you can look through that and see the requests and see if you have the appropriate personnel to help them out and partner
Yes,
with that.
we have one paramedic who works with us. She helps coordinate all of our services with the area police and fire departments. She also works with all the individual community organizations to make sure that if people request us as much as possible, we can be there.
So besides the ambulances, you also do other outreach events where you're giving out information, that kind of thing?
That's true. We do. We have we're about to start a new CPR program, and we have a new CPR machine that's a hands-only CPR, which really the key for saving a life whenever you have a heart attack is to start doing CPR immediately. And so we now have a machine that can teach anybody anywhere how to do hands-only CPR until the medics arrive.
That's nice. That's nice. So you also have a program you had mentioned where you keep the patients. I don't even know what I'm saying here. You have another program that we haven't talked about.
Yes, we have a new program, and we're going to start working with our area hospitals. And for patients who are really sick and have to go to the hospital frequently, cardiac patients that may have
Ongoing
COPD,
treatment, right.
Lung problems, that sort of thing.
Uh-huh.
For patients that are in and out of the hospital, we're going to start coordinating their transfer home care so that we can make sure that they know how to take their medications, that they understand the instructions they were given at the hospital, and we can check in on them to try to make sure that they don't get sick as frequently and try to keep them at home.
It's a preventive program.
It's a preventive program, and I think it's going to be very, very good for our patients.
That's nice. There's so many programs that you offer that it's just amazing, and I'm very glad that you were able to come on here and tell us about some of these programs. And I'm hoping that we can come on again, that you can come back with us and talk more about what you do with the public health and things like that, because I know that could be a whole hour talking about all those things. I mean, we touched on that a little bit about all the different possible outbreaks we can have. And it seems like the last one was Zika.
Yes.
Something like that. So we have no Zika here right now, or where are we at?
We are okay. We are okay with
because that has to do with the mosquitoes, right?
Yes, we are okay with Zika. We don't have problems with Zika in the county at this present time.
That's good. Maybe spring when the mosquitoes come back, right?
Well, hopefully not.
Hopefully not. So you also have a Facebook page, and that is MCHDTX. And the webpage is mchd-tx.org. And you have Twitter. I know, because I sent you a tweet today. It is MCHDEMS.
That is correct.
Okay. So, and then people can always call you, 936-523-5000?
Yes, indeed.
Okay. What else have we not touched on? How long have you been with the hospital district, Randy?
Well, I've been with the hospital district almost 5 years, and it's been fantastic. I tell you, we have really smart young people there. It's a very, very good place. I'm so proud to be with Montgomery County Hospital District. I think it's a very smart way to provide health care. I think that we're able to provide EMS services and spread our overhead throughout the county, and I think it's very cost effective, which is unusual, I guess, for a government agency, so we might laugh, but I will talk just for a minute about our board. I'm the CEO, but the hospital district is it's a government entity. And so we have 7 board members. 4 board members represent the districts that the commissioners represent. And then we have 3 at-large board members. We have 1 new board member coming on board at the beginning of the year, and the board does an excellent job. I've had a consistent board since I've been here. They've been excellent guidance for me, and so it's made it possible that we can grow our programs.
And that goes through the election process,
yes,
right?
It goes through the election
I know we
process.
just had that process, and Georgette was reelected.
Yes.
I don't know what position she has.
Georgette was reelected. She's been there for a long time, and she's very helpful. And her focus, she really likes to focus on the personnel. She wants to make sure that we have good people, that they're treated well and paid well, and she takes good care of us in that way.
Very good. So, you help with prevention? you help with emergencies, you help with education, and you inform people, but you also have other programs besides the emergency and besides the classes where if you have people that continually need assistance, they can get on another program that you do to help them so that they always will have some way where they can get connected to the medical services they need.
We do that. Also, I want to talk in conjunction with 911 and Chip Van Steenberg. They have a new app at 911 called Smart 911.
They do.
Which allows, if you've got some special concerns or special problems, call Smart 911, and you can fill out a profile for what your special needs are. And then when you ever need some help and you call 911, that will help our phone answerers know exactly what your problems are so that we can get to your specific problem as quickly as possible.
And that's connected with your specific phone number so that when you were to call, it will come up and that will show your profile.
Yes,
Is that correct?
Exactly. That will show up on our phone answering computer system what your problem is and what special needs you have. Yeah.
What's your problem? Well, okay. So what you need to do is go to their Facebook page and find out what's going on. I notice they do post quite frequently of things that are happening. And that, again, is MCHDTX. And while you're
That's
at it,
correct.
go like my page too, EMC News. Just saying. And we will have a link of this that will be posted to the EMC, East Montgomery County News page. Later, probably tomorrow, it will also be on IR Lone Star /EMCN. And hopefully you all will share this so you can learn more about the hospital district and what a needy, proficient, efficient system they have of helping our community. I mean, they've even lowered the amount of cost it is for taxpayers and people that use their services. So that's outstanding, Randy.
Well, thank you.
I'm glad that you're with us. Well, that's all we have for today. So this part of the show is sponsored by Big Thicket Veterinary Clinic in New Caney, and they serve all the small animals and the large animals, and they even make house calls for your donkeys and horses and all of them. Monday, December 5th, we will welcome Lenora Purvis with Heaven's Army about Operation Giving Heart that will help over 1,000 children receive a Christmas on December 19th. And she's going to talk about her many programs, but that one in particular, and it's a great way to get back to our local families. We hope you've enjoyed the show today. I'd love to hear from you. Contact me via Facebook at EMC News or by email at margie@taylorispr.com. Thank you for listening. Tune in next Monday, and be safe.
Thanks for checking out this production on Lone Star Community Radio, Montgomery County's radio station. For more information on this show and other shows on Lone Star, check us out online at irlonestar.com. If you're interested in sponsoring a program on Lone Star Community Radio and reaching the local audience of Montgomery County on FM, internet, and TV media, please call 936-647-5747 or contact us online at irlonestar.com. This recording is a Lone Star Community Radio production, produced by the show host and Dick Schissler of Lone Star Community Radio. Interested in volunteering as a music DJ or starting your own talk show? Contact Dick Schissler at dick@irlonestar.com or by phone at 936-647-5747.